organizing this meeting. I think it's important to make sure everyone has the opportunity to hear the updates to the benefits plan, some new options being rolled out, a new insurance carrier for that matter on the dental, vision, and life insurance options. So Sun Life will be replaced effective September 1st with Guardian on dental, vision, employer paid life insurance, and you'll actually have an option to enroll in additional life insurance if you choose that you would like additional. The one big caveat on the we'll call it voluntary life insurance, that's in addition to what full cycle insurance is paying for your basic life insurance benefit. But the caveat on that is participation. We would need at least 4 employees to enroll for Guardian to honor that policy. So that's the important caveat. What we encourage you to do is to look at the pricing, and it's going to be so much of an easier experience this year for each of you to go through and make your enrollment elections. It's all going to be through an online portal called EASE, EASE. It's one of the most intuitive systems out there to compare your benefit plans, compare the costs, and make your elections. So getting away from paper and saving some trees, and also making the administration more efficient so Tim doesn't have to track you down for that paper enrollment form. So those are some of the big updates. The other aspect, I guess, that's really important is the health plan itself is still, it's going to be renewing with United Healthcare All Savers, so the same insurance carrier. However, there was an opportunity to add some additional choice. One of the goals that Tim felt strongly about was to try to get a premium level that was a lower premium for the young, healthy, invincible types there in your office, and also people that realize that, hey, this plan might be okay for me at a lower premium. So that will be the big update. Instead of just one health plan option, you're going to have another option available. Lauren's going to go through all of the nuances of the plans as I transition it over to her. I just wanted to make sure I was part of this on the beginning. I do have to bow out for a call that I have at 10:15, but I'm going to stay on in mute mode just in case I need to support Lauren or any of you on the call. And again, as Tim mentioned, this will be recorded, so we can make sure it's available to you after the fact. If you wanted to, I know they talked about this one thing, and listening to the recording would be helpful, or for those of you, including Holly, that couldn't make the meeting. So Lauren, I'll pass it off to you. I'm going to mute myself and turn my camera off, but I will be kind of here, especially towards the Q&A section at the end, since I know Tim and the group pretty well. Okay. Thank you. Everybody, go ahead, Lauren.
All righty. So Tim, can you guys all see the little plan comparison here that I've got up?
Yes.
We can.
Okay. So when you're going to go into EASE to enroll, you'll go through your profile. You can verify all your personal information, which we encourage you to do because we put in what we believe is all your information. But if you've recently moved, that's a great thing to update. And then it'll walk you through the benefits. It's actually really, really simple to get through. And this first page that I have up is one of the things that is in there where you can actually, in the medical section, you can click on the little thing that says to compare the plans, just so you can see them side by side. So I thought I'd just show this to you just so you know that we can kind of see the deductibles together, that type of thing. So you will have the 2 options that Brent mentioned, both still with All Savers. One of them is similar to your plan before. It's the $3,500 deductible. It's an 80% plan. So if you look at these lines, you've got the $3,500 deductible, office visits for your primary care, $25 copay. Specialist is going to be a $75 copay. Anything that's in the hospital, inpatient, outpatient, MRIs, that kind of thing will be 20% after the deductible. So you'll meet your deductible and then you'll pay 20%, and United All Savers will pay 80%. That will happen until you meet your max out of pocket. So you'll pay on this plan $3,500 deductible, then you pay 20% until you reach your max out of pocket, which at the bottom here is $7,900. And these are both for individuals. So usually for the family. So if let me switch really fast. So here is the $3,500. This is also available on Ease. So Ease is going to have in the medical section, you'll be able to click on a plan highlights link where you can bring this document up. You'll be able to click on a link for the SBC, which is a summary of benefits and coverage. And that'll give you a little bit more detailed information on how does it cover labs and MRIs and mental health visits. So you can click on all those links inside Ease and it'll bring up documents like this. So this first plan, it shows the highlights of the network options. It's $3,500 deductible in network, $7,000 if you go out. And just make sure that you make every effort to stay in network because those are separate deductibles. So if you meet your in-network deductible and then you do one thing that's out of network, the out of network is separate. They don't start you at the $3,500 you've already met in. You start a totally new out of network deductible. So we really encourage you to stay in network. The co-insurance, similar to the deductible, All Savers will pay 80% once you've met your deductible if you stay in network, and they'll only pay 50% if you go out of network. The max out of pocket, if you are covering your family, instead of $7,900, it would be twice that. So it would be the $15,800 if you are covering a family. And then we'll go back to our little quick summary. So if you go to the, yes, go ahead. Did somebody say?
I think we're all kind of squirming here a little bit. Are these premiums per pay period for single coverage for?
Oh, no, you can ignore this little premium. So I just took this from, we have a test employee that we put in to test for Ease. So you can ignore this premium because that's for a family.
Okay.
That's not for
a lot of money for a single person.
And we can, and I can show you. So I have Ease up, and so at the end, I wanted to show you just some quick kind of screenshots of what you're going to see. I'll kind of display how you can see the employee cost versus employee plus spouse. So we'll do that at the end.
Okay.
So this, yeah, you can ignore the cost for right now. We're just going to go over the plan. We'll
Just a verbal.
Oh, that's a verbal. It's fine. I think we already mentioned it, but we are recording this, so make sure that if you're asking personal questions, you're real good with all of your future new hires, hearing about those. So we'll maybe we'll just save all of our like personal questions, whatever, till the end where you can just talk to me or to Brent or that kind of thing. So let's pick up here at the emergency room. So the emergency room on that initial plan, you'd pay a $300 copay, and it's subject to the deductible and the coinsurance. And because of that, we really encourage you to make every effort to visit urgent care, or some doctor's offices have after hours where you can, you know, from 5 to 9, they have after hours. I know my doctor does that. So obviously if you're having a heart attack or something very concerning, you would want to get yourself to the emergency room, but it is always good to check initially and find out where's the closest urgent care. You can call them and tell them what's wrong with you. I know I've had people with, you know, children, they break their arm. They were able to go and get it set with a cast at urgent care. So, you know, call them and see, is this something you can handle? And they'll tell you immediately if it is or isn't and send you to the emergency room if not. So we do want to encourage you to try and keep your costs down, just because that emergency room benefit, that's a pretty expensive benefit to pay the copay and the deductible if it's something that can be handled outside of the emergency room. If you do have prescriptions, then tier 1 prescriptions are $15, tier 2 are $35, tier 3 are $75, and then tier 4 are $250. It is good to take to maybe have a list of alternative options when you go to your doctor, just to see. Some people really need a specific formulary, but a lot of people, they can take anything. And so you know, if you ask your doctor, hey, can you try and prescribe me a generic that's less expensive? Also be aware that for a lot of medical plans, the claims can be, they average around 60% for RX. The pharmacy benefit is what costs the companies the most as far as claims go. So if there is any way to reduce those claims, then it helps your renewal the next year. It helps to keep those rates down. So so anything you can do to reduce those costs always helps the plan later. It helps your cost. Additionally, all of the, you know, Walgreens, CVS, Target, Walmart, they all have their little like $4 prescriptions. If you do your prescription through that $4 prescription, they don't even have to run your insurance card, and it doesn't go against the plan at all. And it's cheaper than anything you could do on the plan. So so if it is, you know, a generic prescription that you can get through their little $4 list, which they have it online, they can, you know, tell you whether it applies there. That's always helpful for the group as well. So if you were to go out of network, again, the deductible for one person is $7,000 on this plan, $15,800 for your out-of-pocket max for one person. So do avoid that. And this plan utilizes what United Healthcare calls the Choice Plus network. Choice Plus network is a huge network that encompasses the whole country. It's something that you've probably already, you know, picked your doctors and have been using them on the plan so far. So that won't be any disruption for those of you who were already enrolled in the plan.
Plan is Choice Plus, so this is, the left column here is much more similar to the current plan than the right column, which is the smaller Navigate plan.
Yeah, we're going to move to that Navigate plan now and just kind of go through some of the differences. Like Brent mentioned, we know that some people, especially a lot of our younger, you know, your younger new hires or whatever, a lot of younger people, they don't go to the doctor very often. They don't have very many things that are wrong with them. And so, or they need something that's a little bit less expensive if they're not going to be frequently visiting the doctor. So we did want to offer you an option that was less expensive than that, the $3,500 deductible plan. So what we came up with, it's a $5,000 deductible, still through All Savers. It is called a Navigate EPO plan. And what that means, it's like an HMO plan, and it has no out-of-network benefits. So let me show you the little plan highlight page for this plan. So this plan, and I've highlighted this up here, this plan is going to require anyone who enrolls in this plan to select a primary care physician. So this, true to how an HMO works, if any of you have ever had one, you do have to have a primary care. And if you want to see any doctor other than your primary care, the primary care physician needs to refer you out. So if you need to see a specialist for, well, whatever, dermatology, or you have something wrong with your foot, you would need to get a referral from your primary care. So it's important to know that you would have to choose that. We will need to either have you tell us, if you elect this plan, who do you want your primary care to be? And it does list that you can go on this little summary here. It says you can go and visit myallsaversconnect.com, and you can search for doctors in the Navigate EPO network. So that's something that if you're currently on the medical plan and you think, you know what, I think I might switch to this other plan, be sure to check the website just to make sure that your doctor is in the network. The Navigate network in this area is still, it's a really big network, but you for sure want to check it to make sure that you're not losing a doctor that you absolutely refuse to see anyone else. That's important. If you do not choose a primary care physician, if you don't indicate, you know, their name and their ID number from their website, then United can't enroll you in the plan without having a primary care. So they're going to assign you one. They're just going to take your home address and they're going to assign you a primary care that's close to where you live. So it's not like you won't be enrolled, but you would be assigned one. And if you decided, you know what, I don't like this primary care physician, you can change it. You can just call the customer service number on the back of your card and say, you know, I'd like you to change it to, you know, this person, and they can do that for you. So this plan has a $5,000 deductible per person, or 2 times that for family. And then the co-insurance on this, so once you meet your deductible, the co-insurance, All Savers pays 80% and you'll pay 20% until you reach your max out of pocket, which on this plan is $7,900, similar to the other plan. So let's go back to our little side by side. Well, we can look here. On both of these plans, let me scroll down a little bit. So on both of these plans, it's not mentioned here, your preventative visits are free for both plans. So on either plan, if you go in for a preventative visit, your annual physical, those will be free. And we highly encourage you to do that. It really helps to diagnose early anything that might be wrong with you. And when you catch things in the early stages, it's so much easier to treat for most cases. So for both plans, that would be free. So on this $5,000 plan, if it's not a preventative visit, then your office visit would be a $25 copay for primary and a $75 copay for specialist. So it's the same as the other plan. Same deductible and coinsurance if you go to the hospital, inpatient or outpatient. It has the same benefit for the emergency room. So you'll still pay $300 copay and then your deductible and coinsurance, but pay very close attention to what emergency rooms, what hospitals, I guess you should go to. If it's a true emergency, it will be considered in network wherever you go. But let's say you go somewhere and you stabilize. As soon as you're stable, they expect you to move to an in-network facility, or else things are going to start being charged to your out-of-network benefits. So it's always good to know ahead of time where do you want them to take you if you have to go to the hospital or that type of thing. The RX benefit is also the same, $15 copay for tier 1, then $35, $75, and $250. Out of network benefit for this HMO, it doesn't, there is no out of network benefit. So it says very, very limited coverage. We have in the website, we have the SBC that'll tell you anything that might be covered out of network, but your hospitals, your doctor's office visit, that type of thing, you're going to need to stay in network. Does anybody have any questions between the two plans before we move on?
No.
Okay.
Can I chime in real quick? This is Brent, everybody. I think that summary was really good, and thanks for letting them know, Lauren, that the full plan summaries will be available in ease, and I know they've been emailed to Tim, but he shouldn't even need to have to forward them to everybody since they're all available in ease. But the telemedicine option, I think, is important to note, especially with COVID-19, that both of the plans include telemedicine visit through HealthiestYou.
Yeah.
Has anybody taken advantage of those?
I have. They work really good. Yeah.
We've got a couple of people saying yes here.
So for those of you that haven't taken advantage of it, please familiarize yourself with HealthiestYou. It's such a convenient way to visit a doctor. I probably use this example too much, but having young kids, especially with COVID-19 this year, the last thing we want to do, unless it's a true emergency, is have to go sit in the doctor's office. And there's so many things that you can actually get addressed via a virtual visit, and that list just continues to grow. Things to include behavioral health types of components. So HealthiestYou, no copay, it's included in your plan. So in essence, you can talk to a doctor real time, live. It just takes a little bit to set up on the front end through the HealthiestYou portal, and literally within minutes of talking to that doctor, they can have a prescription sent to the pharmacy of your choice if it requires a prescription. So glad to know that some of you have already familiarized with that service, and just wanted to chime in on that additional component. And then on the Navigate network itself, the general rule of thumb when you compare the PPO plan with the bigger network, the Choice Plus network, is the Navigate network in Maricopa County is going to have about half of the providers, half of the doctors' offices and facilities. And the big one that's missing from the Navigate network is the Banner hospital system, but Dignity is in network with the Banner plan itself. So it's still a pretty substantial network, but to get that additional cost savings, that's why they go with what we call a narrower network on that plan. But most of you might find that it has a fairly sufficient network adequacy. Like we even checked Tim's primary care doctor as an example, and he's showing in the network as well too. Just like always, make sure that you're going to a provider regardless of the plan that you choose. That's all I have for now.
Okay. So I was going to be hitting this document next. So this is a document that I've kind of split up for you in the EASE system. It's just a welcome kit from All Savers that gives you a bunch of information about the All Savers plan. So they're going to go through, they'll tell you how to sign up in myallsaversconnect.com so that you can go online, you can download your explanation of benefits when you have a claim, that type of thing. It goes through how to find doctors and hospitals. So it gives you the website, it gives you information on selecting a primary care. So all of these documents are saved in EASE in the documents that are available to you. And I mean, at any point, if you reach out and have questions, you can always ask us and we can send you anything you need. But understand your pharmacy, we've got the information on wellness. So United Healthcare has a program called Motion, which we put a brochure for that in EASE. The Healthiest You that Brent talked about, they have Rally. So you can go online and track all kinds of health information, health goals there. So All Savers and United, they have some really great programs to help get you into shape and then keep you into shape. So those are good tools if you want to utilize those online. They also have phone apps that you can download it on your phone and you can obtain that. I like to download the apps onto my phone just because when I go to the doctor, you can pull a digital ID card from the app. So that's always nice to have as well. Let's move to the Guardian benefits. So Guardian is new this year. And so we've moved 3 products to Guardian. So we used to have the vision coverage with United, and that's moving to Guardian. And then the dental and life coverage that were with Sun Life are now with Guardian as well. So is this flashing for anybody else?
Yes.
Yeah.
That's annoying.
I don't see any flashing.
Okay.
You guys are all imagining things.
Oh, my dog. Let me close the door really fast. So the Guardian Life Plan is similar to what you had before with Sun Life. So it's a $25,000 benefit, life AD&D, and the group pays for it, which is really generous. So that is awesome. In addition to that life plan, which you get for free, you can now elect the voluntary term life. So if you are an employee, you can elect anywhere between $10,000 and $150,000. For this product, your guaranteed issue, which is you can elect $25,000 with no questions asked. They don't care if you've been diagnosed with cancer or whatever. $25,000 you can elect, and there will be no questions asked. Anything between $25,000 and $150,000 will require you to fill out a medical questionnaire, which we've loaded online. So when you elect, let's say you decide you'd like to have $100,000 extra in voluntary life coverage, it'll just prompt you to answer some little questions. Have you had, been tested and diagnosed for any of these conditions or illnesses, that type of thing. You can also enroll your spouse, domestic partner, or children in the life coverage. So spouses, you can enroll with either $10,000, $20,000, or $25,000. They can't have more than what you elect. And then any of your children between the ages of 14 days up to 26 can be covered for $10,000 each. Now, if you are 65 or older, then the benefits decrease. So I don't know if you have any employees that are 65 or older, but there is a decreased benefit. So pay attention to, go ahead.
We don't have anyone 65 yet.
Okay, so we don't have to worry about that. With the life insurance, if you are going to cover a spouse on the voluntary life coverage, the rates for the spouse are based on your age. I don't know if that's going to matter to anyone, but that is the case. And as you turn 65 and then 70, the benefit for whatever you've chosen, the benefits do reduce 33% at age 65 and then 50% when you turn 70. Also for spouses, when a spouse turns 70, their voluntary life coverage will terminate. So the coverage for the spouse does not go beyond the age of 70.
When it decreases by the 50%, is that off of the already reduced 33%, or is it
The original,
does it go back to the original?
Yeah.
Okay.
Yeah. Any other questions on the life benefit? Okay. Then let's go on to the dental. The dental benefit it's similar to your plan before, where it's a Guardian network called Dental Guard Preferred. So when you go online, it says that you can go to, and we've listed, I think it's in one of the other pages. I'll just go to it later. It lists that you can go to the website, which is guardiananytime.com, to look for providers that are in network. And so when you go to search, you can have the summary up, which says the network is Dental Guard Preferred, so you know which one to choose. We do list the per paycheck deductions on the plan summary, if that's helpful for you. So for your dental, there is a deductible for class 2 and class 3 services. So those are your basic services and major services. It's $50 per person or $3 per family. That's something that won't apply to your preventative services. Preventative is just going to be your basic care, your exams, cleanings, basic x-rays, that type of thing. So if you stay in network, now this says in and out of network that it's the same percentage. So technically preventative care would be covered 100% up to your annual max of $1,500. Your basic care, which is your fillings, that type of thing, those will be covered 80% by the insurance company, and then you pay 20%. And then major care, which is your dentures, your crowns, that kind of thing, that will be covered 50% by Guardian, and you'll pay 50%. If you have children that are under 19, then you will be able to use an orthodontia benefit, which you can have a lifetime max of $1,500. So if you've never utilized an orthodontia benefit for one of your children before, then you could have up to $1,500 in benefit. If maybe in the past you've utilized you have somebody in braces right now, but they've only used $1,000 in an ortho benefit, you can do the additional $500 under this new Guardian plan.
Well,
so,
Lauren,
yeah.
I want you to check, because it's still doing that flashing. Do you think on the next benefit summary, you can just do a quick snapshot and maybe share that screen? I'm sure it's making people dizzy. It's kind of a weird little glitch. And then I will point out, everyone, that orthodontia benefit is an enhancement that's being made. So your Sun Life dental plan today did not have an orthodontia benefit, and we know that there's some of you that have kids where child orthodontia has been inquired about. So we were able to find that Guardian had child orthodontia as a new benefit. Call it an enhancement that's being made from what was offered through the end of this month.
Okay. This one is not flashing, so that was good. I did a little screenshot. Now it's good. So with the benefit, now Guardian does have rollover benefits. So If you have unused benefits from last year, there's a certain amount that will be able to roll over so that you can actually increase what you have access to the next year. Now, if you need, I said it appears initially that, you know, the in and out of network are covered the same. You have to be careful about that because Guardian does say, yeah, we're going to cover it 100%, but it's 100% of what they believe to be usual and customary. You know, something that. Now, Brent, is this a UCR or a MAC plan? Do you know? Let me go back to the other one.
MAC.
It is MAC.
Yeah.
Okay, so with this type of a plan, when we say it's a MAC plan, we mean it has maximum allowable charges. So Guardian says, yeah, we're going to cover 80% of a root canal as long as it costs, you know, $500 or less or something like that. And so if you're going to a dentist that charges more than what Guardian considers what their maximum allowable charge, you'll pay the 20% of that root canal plus anything above that your dentist is charging. So that's why you can't just look at the in and out and say, oh yeah, I can go to out of network. It's just the exact same. It's not the exact same because you will pay the difference if they charge more than what Guardian allows. So do be very careful with that whenever you're given a dental service plan. Have them do a pre-certification through Guardian to find out how much Guardian is actually going to cover so that you don't end up paying something out of pocket that you weren't planning on paying. So any questions on the dental? Let me go here. We can cover what's in the different. So if you want to see what's in the preventative, here, let me get rid of the flashing really fast. Okay, so as far as what's included in each of these classes, so preventative care, like we mentioned, is the cleaning, fluoride treatments, exams, sealants, x-rays. And I do encourage you to have your children's teeth sealed if you have children that are 14 and under, because that is something that it's terrible to have to pay a root canal on a child who's 4 when they're going to lose that tooth. So sealants just kind of puts an epoxy layer on the teeth and really helps to protect those until their teeth fall out. The basic care, that's going to be your perio, surgeries, endodontics, root canals, fillings, anesthesia, all those types of things. So these are great things that are in the basic class. And then major care is going to be your big things, your bridges. It's nice that they cover implants. That's not always included in dental plans, and implants are pretty expensive. And again, your orthodontia for children who are under 19. Any questions on the dental plan?
Could you go back up? I just want to see what the pricing was for one more section.
Yep.
Okay, thank you.
Well, Jordan, can you reiterate the impact of the rollover concept? Is that from Guardian year to year, or is it of any interest to us as some of us are on the Sun Life plan rolling over to Guardian at this point?
Brent, do you know what it is for switching from Sun Life to Guardian?
Or if it's an open question, you know, is there anything we need to do to get information from Sun Life as to?
Tim, it's a great question. It's more once you start on the Guardian plan, the rollover comes into play. So the specifics of it, we'll make sure that there's a flyer in there. Guardian actually was, I think, the first group health insurer to really pioneer this rollover concept, and a lot of the other insurance companies have started to follow suit as like kind of a added enhancement. So the general takeaway is you have to get your cleanings per calendar year to be eligible for the rollover. So in essence, get your preventative dental care, and then whatever portion of your annual maximum is not being utilized, you can roll over year over year and increase your annual maximum by that additional $1,250. So you think about it, most people are not going to need, much dental work every single year. Yes, there are some people that, blow through their annual maximum every year, but most people, you get your cleanings and then maybe every second or third or fourth year that you might need a more expensive dental procedure like root canal or what have you, that rollover could be super valuable to take advantage of. So you're not going to start over or start with a rollover, but at next year's open enrollment, as an example, if you've gotten your 2 cleanings, then you're going to be able to roll over up to $700 of your unused maximum. Does that help a little bit?
Yes.
And
Okay.
the lifetime orthodontia, it's $1,500 for
Yes,
per kid or for
Per
child.
orthodontia?
yeah, per child.
What I would say on the annual maximum for ortho, a lot of employers, we just went through a renewal and open enrollment for one of our other clients that has $1,000 maximum. I think the highest orthodontia benefit for children I've seen in the past year is $2,500, but then the premiums go up substantially. So that $1,500 isn't going to cover the full course of braces, but it's going to cover more than half, I would say, of most kids getting their braces. My daughter just got her braces on about a year ago, a little less than a year ago, and it was like right at $2,400, I think. So that gives you an idea that you're still going to probably come out of pocket a little bit, but the benefit takes up a huge chunk of that.
Any other questions before I move on to vision? Okay. So the vision plan also with Guardian, you can still search out your vision providers on the Guardian network. So www.guardiananytime.com, and it is on this summary. The vision costs per paycheck are listed here. So if you have a vision provider, you go in for an exam, you'll pay a $10 copay to go in and have an exam. If you don't need anything, they checked your eyes out, you look great, then that's all you're going to pay. If they decide that you need glasses or contacts, there is going to be a materials copay. Now, for the exam, it says here in network, if you need to have single, bifocal, trifocal, or lenticular lenses, you're going to pay nothing. Now, keep in mind that this says lined bifocal and lined trifocal. So if you like the progressive lenses or, something like that, those will cost you extra. But if you want a simple lined bifocal or trifocal, then it will be free. Also, the lenses can occasionally cost more if you have a very strong prescription. So if you're a little bit blind and you have a pretty strong prescription, there are some materials that won't fit in the frames that you choose with a regular material. They've got to do a lightweight material in order to have that work in the frame that you choose. So that's why sometimes you'll say, why are my lenses costing me $60 a piece? That might be why, because of your prescription and the material they need to use to get it into your frame. If you do choose to have frames, so frames are covered, you can have up to $130, and then they'll cover, you'll get a 20% discount for anything over $130. And then for contact lenses, you also have up to $130 for any lenses that you need. Now, the contact lens exam, that is a little bit different from a regular glasses exam. So they typically will cost about $50 for a contact lens exam. Now, some people have different restrictions or requirements for their eyes because of different things that are maybe wrong with them or that you experience. So that's why they do have a custom fitting here. But for the most part, a standard copay for a contact lens exam is $50. There are discounts for additional things. You've got your tinting. Sometimes you're on a computer, so you want the anti-glare maybe for your computer or for night driving, or that the scratch coat because maybe you have your glasses, they're on and off a lot. You don't want them to get scratched. So just make sure when you get your glasses that you just ask them, well, what is that going to cost on my plan? Because some people get upset that they have a plan and then they end up paying, $300 and they think, geez, why did I do that? But the plan is to help you get exactly what you need. But a lot of times the cost is to get you what you want. And it's expected that we would pay for the things that we want. They do, they're there to make money. And so don't be surprised if they offer you little bonus add up things that might add on to the cost. Just ask them what it's going to cost and figure out if that's something that's worth it to you. You can have an exam every calendar year and lenses every calendar year. Now for frames, you can only get new frames every 2 calendar years. So make sure that you can still get new lenses every year. You would just have your lenses put into your existing frames, or you would pay for new frames if you wanted to get new frames every year. Now the out of network benefits are listed here. So they'll cover up to these amounts that are listed. So again, we encourage you to stay in network, but if you do go out of network, they can submit the claim so that you're reimbursed these amounts. Any questions on the vision plan?
Is there coverage for laser?
So that is one of the things. It says the laser correction surgery discount. Depending on where you go, you can get up to a 25% discount on the LASIK type surgeries. So there is a discount, but yeah.
So
any other questions?
I'll just chime in with some kind of advice, if you will. Funny enough, I have a eye doctor appointment today at noon, and last year, actually, we did not have vision insurance in my household last year at my last checkup. And it's amazing when you ask about price, even if you're going to an in-network contracted provider, that there's the ability to negotiate cost. Like when I went to that provider that my whole family has been going to for many years, my wife, my daughter, myself, they told me it was going to be $200 or $250, I think, for my eye exam and my contact eye exam. And I just told them, I'm like, look, guys, I could go to Costco and get this for what, $100 max, maybe $85. I said, we want to support your business, but I need you to meet me in the middle. And they ended up dropping the rate down to what I felt was fair. It was $125 versus $250 that they quoted me initially. So just be mindful of that. You all work in insurance. I know it's not employee benefits, but if you don't ask, and I guess just encourage you to be, a diligent consumer and to ask about price and just not assume that the plan's going to cover it, or at the very least, I think Lauren mentioned it, to ask for a pre-certification as to, okay, what are my benefits going to cover for this dental procedure or for this vision visit? So in advance and don't have any surprises. The other big area where we see people constantly getting charged in excess of what they expect, and then they think their benefits aren't very good, is when they get all those coatings that Lauren referenced. My wife is a great example that she came home with an $800 bill on new glasses when we had vision insurance, and it was because she got upsold on all the coatings possible under the sun that the plan didn't cover or only had a minor discount. So just make sure to be diligent about it and know that you have the opportunity to negotiate, especially if you do decide to go to an out-of-network vision or dental provider.
How long does the pre-certification take to get back?
Typically, like with vision care, when you schedule your appointment, they will verify your benefits with Guardian and have that ready to share exactly how things would be covered. So when you schedule the appointment, it would be a good time to do it. Maybe you have to give them your insurance information on that first call, and then before you show up to the actual, I would say this is applicable for dental and vision for sure. before you show up to the dentist or the vision provider to say, hey, this is what I expect to get new glasses with, bifocals or progressive lenses. Can you give me a price quote on that? So I kind of know what my budget is for, frames and anything that I might have to pay out of pocket above and beyond what the benefit covers. So it's not a long process. They have access to the information real time. Probably the one caveat I would say with Guardian being your new insurance company for dental, vision, and life insurance is don't schedule for September 1st. You probably want to give it, if you don't already have an appointment on the calendar, to the second week in September, just to make sure all of your information has filtered through their systems and providers can verify the benefits.
Also, if you haven't gotten your ID card for some reason when you're scheduling, your benefit, for vision, you don't even need an ID card. So on this vision summary, it lists your group number. And so if they have your name and your information, which obviously you have, and then this group number, they can look at your benefits and figure out what's covered just with that information. So don't ever worry about needing an ID card for the vision, because they can do without it for the vision benefit. So Brent, are you okay if we just review some things? I just want them to see some things in ease, just so they kind of know what to expect there.
Yeah, I think that would be good. And thanks for covering as much as you have thus far.
Okay, so the ease enrollment system, I'm just going to pop into, we have a little test employee that we went through. So I just want you to kind of see what you're going to be looking at once we send you the login invite today. So this is where we've already loaded a lot of your personal information, your name, your address, that type of thing. So do review that just to make sure everything looks right. Then it's gonna, you'll just do continue, and it's gonna take you to a dependents section. So the dependents that you list here, this could be people you're gonna add to any of the coverage, or it could be someone that is not on the coverage, but you just want to list them in case that's somebody you think you might add in the future. For the benefits, it's going to walk you through each plan. So here's the medical plan. Here are all the people that, could be on the plan. So the employee, and then a spouse and a child. If you only want coverage for yourself, so there's a little check mark and an X. So you can check for yourself, but you don't want to cover your spouse. You can just do the X for your spouse, X for your child. And then it's going to ask you, how come you're waiving? So for a group of your size, they'll ask us, what's the waiver reason, just so they can make sure that enough people are participating in the plan and why you aren't. So you can just indicate the reason you're on your spouse's plan, you're on Medicaid, that kind of thing. So if you're waiving coverage, it's going to ask you, you can put other if, the reason isn't there, but they have most of the reasons there. So you could indicate that at the time for the spouse and the child. Then you can go down, you can select your plan. So right here, only the employee is selected. So it's going to give us the cost here for employee coverage on the two plans. So that $3,500 plan for an employee would cost $59.20 per pay period. If we were to select the All Savers plan, it would be $24.81 per pay period. Now, when we selected the All Savers plan, this popped up down here, the primary care physician information. You will need to put it in the primary care physician ID, which you would get from the website. You'd have to go to the My All Savers Connect or whatever.com, and you'd have to find the physician and put their ID and their name. And the reason we ask for both is because sometimes we get ID numbers in here for some reason that they're not real ID numbers. So if you put the name, we can actually look up the doctor and put in the correct ID. So if you put both, that's great. And if you don't care, you can just click auto assign. And then that will allow us to get you enrolled. So if we look at the dental coverage, same thing. You can just indicate who's going to be covered. So as let's say you're just going to cover you and your child, then it changes this amount. So you and a child is $44. The whole family is $59. If we take out all the dependents, just the employee is $16. So that's how you can figure out how much is it going to cost if I cover my family. I don't know. You can just do the checks and X's like that, and that will allow you to navigate through. For the voluntary life is a little different. So with the voluntary life, like we told you before, you can elect $25,000 with no questions asked. So you'll notice that 10, 20, and 25,000, they don't have the little asterisk next to them. Because if you choose them, if you choose 25,000, then we'll say you're choosing nothing for your spouse and child. If you choose 25,000, it's going to say down here, that costs you $1.87 a pay period. Now, if you choose, let's say you wanted 100,000, okay, it still says $1.87 and it has an asterisk. And what that means is we're only going to charge you for what's guaranteed until you fill out that questionnaire and you answer the questions, because until you get approved for the additional amount, we won't charge you for the additional amount. So at that point, you would have to answer a medical questionnaire. And then here in the beneficiary section, we do want everyone to indicate at least one beneficiary, where you can just say, now that's why I say it automatically feeds your dependents. So even if you're not covering them, you might want to put them in just because it lets you assign them as your beneficiary. Or you can just enter a new person as a beneficiary. If it's your mom or your dad, you can just go down to the add a beneficiary line and add them here. Because we want that just because everyone has the company paid life. So do make sure that you've indicated one in each of the sections. You can do the same one for each section. One of them is for the life portion that the group pays for, and then the other one is for the voluntary life section that you pay for. And then when you get to the end, you'll be able to you can print a summary of everything that you're elected. There's a little link here that you can see that says print your summary. And then all of the deductions listed here, these are all per pay period. So you'll be able to see what your total deductions will be, print the summary to keep, and then you should be all set. So if you have any problems with the login we send you, with electing any information, just give us a call and we'll be able to walk you through or fix your login or whatever. Also know that when you first sign in, it'll be one link, but after, let's say you don't finish your elections when you first sign in, and you have to go back in later. So Brent, let me see. I'll have to look at the login to see, because if you don't finish when you first go in, you'll have to go to like, is it fullcycle.ease.com, Brent? I don't remember if we did Full Cycle or Ride Now, but I'll check.
The link that they receive will have it.
So do know that you don't want to click on that login link twice if you've already logged in and created a password. So, and then we'll be sending out those logins today. So you should be able to start your elections shortly, because as soon as we get off our call, I'll go in and we'll initiate all the logins to go out. We would like to have everybody finished. Tim, did you say by Monday or Tuesday?
I thought we were saying Tuesday.
Okay. So
You think this can work from your perspective?
Yeah. So if everyone can take the time over the weekend to review the plan summaries and the costs with your spouses, you can log in from your homes if you want. So just take the time to go through the benefits and have all of your elections finished by the end of the day, Tuesday. And Tim, I'll send you updates on who has completed and who hasn't, just so that you know if there's anybody we need to follow up with and assist. I think, there's one other thing I wanted to mention. So in the benefits section, within the plan that you choose, there's all these links. So like you can click on the All Savers online provider search, and it immediately takes you to search for pharmacies, search for doctors, search for mental health providers. It'll immediately take you to where you need to go to find providers for All Savers. Also, this is the plan highlights that we looked at earlier. So if you click on that, it'll take you to this little highlight page. And then if you go and you click on the plan summary, this is the SBC that we talked about, the summary of benefits and coverage. And this is where it kind of breaks it down a little bit more in detail, how we're covering drugs, retail, and then if you want to do mail order, it costs this much. That type of thing. So you can get to all of those documents within each plan that you're choosing. So those are available for all your plans, for dental, vision, that type of thing. And you can also go to, where is their documents? I'm rarely in the employee view, but there is a way to view documents that we've put in there. And some of the documents that we've put in there are the brochures from All Savers, the brochures from Guardian that tell you, like, Guardian offers different services like will prep. You can have Guardian assist you prepare a will. Guardian has an EAP, so an employee assistance program that's called Work Life Matters, where you can call and you can get over the phone counseling if you've got maybe a child that has some drug issues and you need to talk to a counselor right then. They have 24 hours, 7 days a week counseling, grief counseling, drug counseling, spousal relationship counseling, that type of thing that you have access to through the Guardian Work Life Matters program. And I did put the brochure in ease for that. They have a college tuition benefit where if you're going to be sending your kids to college, you can actually build up benefits that will credit towards specific colleges that are listed, and I put that brochure in there. So there is information in there that's kind of additional little benefits that that Guardian offers. So just make sure you keep track of your login so you can get into ease whenever you want, in case you're going to the vision doctor and you need to download the summary so you know what's covered. Just make sure you keep your logins handy so that that's something that you can get back in, update your address, add a new baby. Reach out to us and let us know whenever those things are happening, and we can make sure that those are also communicated to the carriers. Does anybody have any questions? Okay.
I have a question for Tim. Tim, Lauren had mentioned the URL to access ease. Right now it's fullcycle.ease.com, and you'll all get a system email, so you don't need to write that down or remember it. But Tim, my question is would you prefer that it's aligned more with your company website, which is fullcycleinsurance.com, or is it okay if it's shortened to just fullcycle.ease.com?
I think we'll be fine with full cycle.
Okay, just figured I'd ask before that.
Once we fix it out, get it in our history, our favorites, our bookmarks, whatever. Hopefully we can find it, and yeah, we should be good from there. If any of you do have any trouble, you don't see the message from Lauren to welcome you to the East site, let me know, because we definitely do want you to be taking a look at this and trying to make decisions as expeditiously as possible.
And I do know that sometimes with people's security, settings, that sometimes the ease emails will go to junk. So kind of keep an eye out for it to make sure that it went to your junk folder. And then if for some reason you've messed up and you forgot your password, I can reset those for you, so you can reach out to me if you have any issues like that as well.
Okay.
All right. Well,
Thank you guys. I think we're good. No one has any other questions for Lauren?
No.
Okay. Well, Brent, Lauren, thank you so much. If you can share with me the however we can access the videotape of this for those that, even those people that were here. I mean, if you want something to do on Saturday afternoon or Sunday, you can watch this again.
Perfect.
Okay.
All right. Thank you.
Thank you. Hey, everyone.
You too.